So let us first start with the assessment part. We will like to assess the sensation of the patient and also the reflexes and the muscle strength. So when you assess the sensations and reflexes, you may find that there is decreased reflex in the arm. You may find that there is lower motor neuron type of paralysis in the upper limb, and so you will find that reflexes are decreased. There may be exaggerated dependent reflexes in the lower limb if there is involvement of corticospinal tract. Dissociated anesthesia below the level of syrinx in shawl-like pattern, that is tape-like pattern, and painless ulcers following trauma may also be present because of sensory loss, especially in the foot. So about the investigation, investigations that are carried in case of syringomyelia are that CT scan, MRI, and X-rays can be done. Nerve conduction velocity testing or EMG may also be used to demonstrate nerve damage. So, what picture will you find in NCV testing? There may be signs of axonal loss, that is, the amplitude of CMAP may be reduced. And in EMG, you will find the neuropathic potentials. Okay. More sensitive electrodiagnostic testing examining our evoked potential studies may also be utilized, and a lumbar puncture in which a needle is inserted between the individual's vertebra to obtain CSF should be performed. Talking about the prognosis of syringomyelia, 50% of the cases there will be no worsening of the disease and it will remain stable. However, in 50% of cases, they may eventually become wheelchair bound. One fifth of the patient they die at an average age of 47. So the surgical treatment available to the patient are: first is decompression, that is the affected spinal cord, the affected segment of the spinal cord will be decompressed using any of these surgery. So they may use laminectomy, removing the lamina of the involved segment, involved vertebrae, then expansive duroplasty or removal of the scar tissue if it is present. Shunts can be done. So the fluid from the syrinx can be drained into peritoneum of the abdomen. So that is called syringoperitoneal shunt, or a ventriculoperitoneal shunt that is done in case of hydrocephalus, where the fluid from the ventricles of the brain is drained into the peritoneal cavity. Or if the cause of a syringomyelia is a tumor, then the removal of tumor can be surgically done. What are the aims of rehabilitation? The first aim is to educate the patient, educate the individual about the disease process, then to improve communication with the patient, maintain the range of motion of joints, increase strength, increase coordination and balance, improve functional abilities like gait. So first is educating the individual. Explain the expected prognosis. So you need to explain to the patient what expectations you have from the rehabilitation program. Ask them about their expected level of independence that they want to achieve through rehabilitation. Explain them about the importance of exercise. Teach the importance of regular skin inspection, because these patients will have sensory loss, so it is very important that they inspect, they use the vision in absence of the sensation. So they use the vision to inspect the skin regularly, and it is important to prevent secondary complications like ulcers. So if they are taught to regularly inspect their skin, then the secondary complications like ulcers can be prevented. And proper skin care or the basic skin hygiene. So the skin should always be kept dry and clean. Improve communication of the patient. You can send the patient for speech therapy. You can teach the patient tongue and facial muscle exercises. And also, the patient can be advised to use an alternative mode of communication like gestural or facial expressions. Maintaining the range of motion is important. It can be done through regular passive movements, through full range of motion, and paying special attention to the muscles which are multi joint. Regular stretching programs, and teach the patient self stretching so that he can do the same at home. Increase the strength by using various strengthening protocols. Strengthening of all weak muscles is necessary, and but care should be taken not to fatigue the patient. Improve balance and coordination. Fine motor and gross motor coordination can be improved through various Frankel's exercise. You can give Frankel's exercise in sitting or in standing position, whichever position your patient has attained independently. And there are varieties of Frankel's exercise that you can utilize for this coordination. Then static and dynamic balance can be improved using varieties of base of support, varying center of mass. So you can use reach outs, you can use the variety of arm movements while holding a particular position, for example, exercising the arm in sitting position or exercising with one arm in standing position, or dynamic functional activities like stepping up on a stool or a partial squats or climbing stairs or navigating the slopes. So these are all functional activities which are dynamic in nature, can be utilized for improving balance and the last is to improve the functional capabilities of the patient. So after your patient has gained enough strength and flexibility, you can train your patient in transfer activities from various surface, from bed to chair, bed to wheelchair, wheelchair to car or wheelchair to commode. Then progress to gait training activities. You can start training him for gait in parallel bar, to walker, or using a stick if required. And if your patient is wheelchair bound, then you have to train him in wheelchair training. How to move the wheelchair forward, backward, how to take turns in wheelchair, how to apply brakes, how to remove the armrest, and how to transfer from wheelchair from different surfaces.